bit different today, and for our in-house audience, feel free to ask questions. And I think that will help everyone else. So in order to understand Medicare Supplement, you need to know about your original Medicare, and you need to know about Medicare Advantage. So we're not going to go too deep on those, but we're going to touch on them, right? So original Medicare, write this down. Medicare Part A. Medicare Part A is your first bullet point. That equals 0. That costs you $0. That covers your hospital. So Medicare Part A equals 0 equals hospital. Now, Medicare Part A does have a $1,634 deductible. But don't worry, because when we talk about Medicare Supplement, we're going to eliminate that. Okay? Then there's Medicare Part B. Next bullet point, write this down. Medicare Part B, the standard rate in 2024 is $174.70 per month. That is income-based. Most Americans will pay $174.70. That equals your medical. So your doctor's visits, outpatient surgery, MRIs, x-rays, ambulance ride, emergency room, labs. That covers your medical. Now, there is an 80% coinsurance for non-preventative procedures. So, this is where your chest gets a little tight, and I want to shock you for a reason. There's no limit on this, so you're responsible for 20% of the bill with no limit. So imagine a $10,000 bill. Not unheard of in the medical world. You got to pay $2,000. Imagine a $100,000 bill. $1 million bill, right? There's no limit on this. So now that I've made your chest get a little bit tight, let's relax because we're going to have that go away. We're going to get you protection for that. It also has a $240 deductible. You're probably going to keep that. And that varies per year based on what the current year's Part B deductible is. This year, 2024, it's $240. So, what's Part A?
0.
Okay, and what does it cover?
Hospital.
And what's Part B?
174.
And it covers?
Doctor.
Medical. We got it. Thank you. See? A, B, C. It's that easy. Now, real quick, because we got to compare the two. So you know your options. We also have Medicare Advantage, known as Part C. But we're going to compare that to your Medicare Supplement. Now, Medicare Supplement, also known as Medigap. Why is it called Medigap? Because it fills that gap. Remember we talked about that 80%? So it's going to fill that gap. So Medicare still is paying bills with Medicare Supplement. Medicare Supplement is going to pay their portion, and whatever typically costs you $0 in most areas. So pretty affordable. You just pay your $174. It includes your Part D prescription plan. Has $0 deductible in most areas, but it has copays. And the copays vary. You do have a maximum out of pocket that will protect you. However, that could be as high as $8,000 in some areas. In our area, probably closer to $800. But that's your protection. Now, it comes with extras, dental, vision, and hearing. So what's the big difference? Medicare Supplement, you don't have, in most cases, you don't have copays or very low. And it does not include your prescription drug plan. You have to pay for that. So why would you pay extra for Medicare Supplement? We're going to talk about that. The average cost nationally for Medicare Plan G, it's around $135. Okay, that's average. If you're turning 65, it does vary in most cases, in most states, by age. As you age, this will go up, okay, in most areas. Then you have to pay for your Medicare Part D. D for drug, for your prescriptions. Average is $35. So if you add your 174, let's round it to 175, plus 135, plus 35, you're looking at $350. So $350. So $0 versus $350. Why would you do that? Well, the main reason is that there's no network, and you can, and don't ever call Medicare Supplement Plan a PPO, because it's better than a PPO. A PPO, there's still a network. The doctor still has to accept the plan. With Medicare Supplement, there's no network. So the only rule is the doctor has to accept original Medicare. Original Medicare. Nationwide, if you live in California and there's this specialist in New York, hop on a plane, you're on your way, you can go see that doctor, as long as they accept original Medicare. And what's the coverage? Super easy, right? It takes that 80% to 100% minus that $240 copay, and that copay is annual. You only pay it one time per year. So pretty good, right? So you're really paying for your freedom here. Versus here, there are networks. If you're in an HMO, you're going to need a referral. If you're in a PPO, the doctor needs to be in network. You're really paying for freedom here. And in a lot of cases, that's important to you, okay? The best thing we could do, though, is to compare for you. Who's your doctor? What's the network? What do your medications look like, right? Now, another downside is Medicare Supplement does not have the extras, the dental, the vision, the hearing, the gym membership. So you can purchase that separately, which we could also talk about. Now, the two most popular plans. I'm going to explain how they work. These are the two most popular. We're going to talk about third one, Plan F. It's only available to you if you were born before 1952. But why am I going to bring it up? Because you might be on a plan. Plan F, Plan G, and Plan N. Those are your three most popular. Your three most popular plans are Plan F, Plan G, and Plan N. So what's the difference between those? You have your cost. Plan F is going to be more expensive. Plan G is a little bit in the middle, and Plan N is a little bit lower. Okay? Then you have your deductible. Plan F has no deductible. The only difference between Plan G and Plan F is that it has a $240 deductible. Right? Now, if you're saving $800 a year because of the premium, well, having a $240 deductible might be worth it to you. Okay? Then Plan N, the difference here on deductible is they also have a $240 deductible on Plan N. Then now let's go ahead and talk about copays. Plan F, which costs you a little bit more, no deductible, has no copay. You go see the doctor, you go to the hospital, you're covered. That's that. Pretty nice, right? At a cost. Now, if you move over to Plan G, or if you enroll into Plan G, the difference is you have that $240 deductible, you have no copays, just like Plan F, except you have that deductible. So you go in, you pay your one time a year $240 deductible, and that's it. You're good to go. Plan N does have copays. They have a $20 copay for doctors and a $50 copay for emergency room. So you go see your doctor, your primary care, your specialist, it's $20. That might be worth it to you depending on how big the gap is on the premium. Now, if you go to the doctors a lot, if you have a condition where you go once, twice, 3 times a month, which does happen, you're going to eat up your savings on the copays. So we have to evaluate that. And the other thing is, we don't know what our health is in the future, right? So with that being said, we're going to go ahead and look at your deductibles. We're going to look at your prescriptions. We're going to have to put them all in to see what makes sense for you. And then what we're going to do is look at the different rates for the different plans in your area. Now, does that mean you're stuck with these plans? No, not necessarily. So throughout the country, there are different rules, guaranteed right rules, right? So if you move, that can make you eligible. If you are leaving your work plan, and you miss your open enrollment period, let me talk about open enrollment. Happens one time. Open enrollment is one time when you turn 65. For the first 6 months from your Part B date, when you turn 65, you are eligible for Medicare Supplement Plan with no underwriting guaranteed issue. After that, you have to go through underwriting. There are many exceptions, but a few are you move out of the service area, you leave your work plan. Okay, that opens up an enrollment period, a guaranteed rights enrollment period. And the other one is some areas will have a trial right, meaning you can try your Medicare Advantage plan for 12 months and then go into a Medicare Supplement Plan with no underwriting. Those are 3 common trial rights. There are more. Let me know and we can look it up and see if you have if you qualify for guaranteed issue. So now what we're going to do is we're going to go ahead and enter your information. We're going to talk to you individually, and because you all have different birth dates, we're going to see what plan best meets your budget, and then we can pick from there. Okay? Thank you. Don't forget to like and subscribe before I hang up here. Have a great day.